we're not seeing you, you're not seeing us, that's just how it has to be, much to their dismay. But now, as we understand more about how this virus operates, we're starting to spend more time together. And I really want to focus on that, on living with this virus, as opposed to pushing pause and waiting for this virus to go away in order to start living again. I mean, all of us have numbered days on this earth, right? And personally, like when it was a week or two, I was perfectly willing to say, okay, I'm gonna hunker down and not do anything. But then that week or two stretched into month after month after month. And frankly, life's too short. So that's not to say we throw all caution to the wind and accept the fact that if you're going to go out, you're going to catch COVID, and you may get seriously ill or even have a life-threatening case of it. But it is to say, like, we can do our part and still live very full lives. So let me just pause right there, Linton, if I can, because I think this might be a good fork in our conversation about what things the audience here might really want to hear about. You know, I'm sure talking to you guys about, you know, how infants fare with COVID-19 might not be that helpful. So I want to make sure we address the topics at hand.
Okay, I've just unmuted everybody, and except Nancy is still muted, but that must be by her own choice. So are there questions to get Dr. Meyer started? I mean, she's already started. Thank you.
So Joan's ready to go.
Oh, go ahead, Joan.
She's still muted, Linton.
Not on my end.
Oh, which Joan?
How about now?
There we go. Now we can hear you, Joan.
Do you
go
have
ahead.
me now? Okay.
Yep.
Good. This is my first solo Zoom, so this is big day for me.
Wow.
Very good.
Nice.
Yay.
Linda always did it, and I just sat here next to her. But this is my first, and she's on a Zoom with other people upstairs. But I had to be here with Christine.
Wow, great.
Couldn't miss you, Christine.
Oh,
although I do miss
thank
you. All right. A question. I was supposed to have cataract surgery on my right eye last December, and I haven't had it. I was wondering whether or not I should wait. I'm fine. I don't, I can function without it, but I'm wondering whether it would be wise for me to keep on waiting to have that done.
Well, so I think there's an opportunity window for elective procedures. If you had asked me this question back in April, I would have said definitely wait. If you asked me this question in October or November, I would say definitely wait. I think right now we're in a really good window because the newness of it and our inability to comprehend how to control this virus and take appropriate measures was not good in April. And in October, we're going to start to see this convergence of influenza and COVID-19, which is going to make any healthcare setting kind of worrisome. So right now, I would say between now and maybe even the end of September, if you're going to a reputable doctor, which I know you are, if you take all of the necessary precautions, hand washing, wearing a mask, I think it's fine to go ahead. We've started to see, I said how at first we all anticipated this to be like a week or two. I've started to see how as we get into our month after month, people's healthcare is suffering. You take what could be a pretty simple cataract surgery and turn it into something more invasive, more complex, because now it's 6, 7, 8 months, a year later than ideally you would have done. So if you can slide into that, safe window and you're confident in your doctor and their setting, I would definitely go for it now. I would say if it looks like your scheduling is going to be into October or November, then I would just wait till the other side, till springtime.
Okay, good. Thank you.
Sure.
Really good information there.
Sure.
Any other question? Another question? So I'm not seeing.
So the other thing I think that is important to talk about is what we should all be doing. Like, what am I supposed to do to protect myself? I mean, in my world, I think a lot about, of course, how to protect myself. I also think about how to protect my kids and my family. I think about how to protect my employees and my staff. And I think about how to protect our patients. So, and it's different. It's not exactly the same for every group of people, but for most of us individuals, tops on our list when we open our eyes in the morning is, what do I have to do today to not catch this virus? So I think that's an important topic to review. There was just a really amazing study that came out of China. And I shared this on Facebook, and I've got so many comments about how, oh, you can't trust anything that comes out of China, which might not be wrong, but this particular study was really very thorough. It was well-powered, meaning it had a lot of numbers, and it was published in a very reputable American medical journal, the Annals of Internal Medicine. And basically what this study showed, they followed 300 and something cases of COVID in China, and then they traced over 3,000 of those patients' contacts for months, for 2 months. And they tried to figure out, like, how likely was it that people who came in contact with these original 300, we'll call them like the index cases, how likely was it that these 3,000 contracted COVID? And they were very thorough in detailing where these patients came into contact with each other. So some of the contacts lived in the same house with the sick patients. Some went to them in healthcare settings. Some worked with them or visited with them in social situations. Some were next to them on public transportation, like subways and buses. And the last category were patients that had multiple points of contact, like they worked together and they also rode public transportation together. And in the end, there was a very low infectivity rate between the sick patients across the board in all those groups. The highest rate of infection happened in people who lived together in those household contacts. And that was only like 10%. So 10% of the people who were ill had someone in their household become ill. 4% overall, and the lowest likelihood was in the public transportation. Less than 1% of people got sick on public transportation. So immediately, you know, the question is, well, geez, that doesn't sound so bad. Why do 20 million people have this disease, and why are so many people dying? Well, remember, China is a communist nation. And in China, they say, you must wear a mask in public or you'll be arrested, or, I don't know, we'll bolt your door shut, or whatever it is they do. But mask wearing in China is mandatory. So across all of those settings, even within households, people wear masks. They make a career of wearing masks. So to me, we could certainly throw out that data and say it's meaningless because it came from China, but personally, I believe in the journals that picked up this information. So I think the take home from it is masks work. They really work, but they only work if people wear them. And they only work if enough people wear them. So if we're going to pick one thing to do as individuals and be like very selfish about it, it's going to be wearing a mask. And that does two things. If you happen to be sick and not know it yet, it will hold your germs in. If you're healthy, but you're with someone who happens to be sick, it keeps their germs out. A good analogy that I saw that was very funny and probably a little off color, but I know 2 out of the 7 people here, so I'm okay with it, is to think about masks like pants, like a pair of pants, right? So if someone's wearing a pair of pants and they pee themselves, their pants are going to get wet. But if they're not wearing any pants, there's like a big mess, a giant puddle. If that same person is standing next to someone who's not wearing pants and they pee, that person is also at risk. But if both parties are wearing pants and there's a little incontinence issue, nobody has a big problem because the pants protected both parties. And it's such a helpful visualization. Not that people, you know, have that problem where you're in public and you're like, you know, peeing next to other people, but the analogy really works because any layer of protection is better than no layer, and the more layers, the better. So I would say if you take nothing else from my message today, it's wear a mask. And, you know, we can break it down. I'm happy to answer questions specifically about where to wear a mask, where not to wear a mask, what type of mask. Those are all really good questions. But first and foremost, wear a mask. So before I go on, any questions about that?
Nope.
Good.
So I'm sorry, Joan, were you going to say something?
No,
I was.
agreeing. That was fine.
Okay.
Joan Neely. Can
Oh.
Joan Neely say?
Yes.
Go ahead.
My question, well, maybe it's too soon, but Christine, the bubble, how does one decide, like you can see your mother, father, how do we build our bubble? Or
I honestly think that is probably the most important question we could answer tonight. And I don't know that there's a good answer for every single person here, Joan, but I will say that, like, for example, and I just have to share my personal experience because I think it's a good way to show you like how doctors think. So for those that don't know, obviously I'm a doctor, but my husband's also a doctor. So, you know, we've been really immersed in this from day one. And we both have aging parents who live nearby, who love to see our kids. We have 3 kids, 20, 18, and 13. And in April, my mom turned 75. And we were supposed to have a massive blowout for her. We were going to throw her, you know, the party of all parties, 300 people. It was going to be a surprise. And it was honestly heartbreaking to not be able to do that for her. So what we did was we just drove to her house about an hour away and stood in her driveway, 20 feet apart. And we put a tiny little store-bought cake on the driveway, like on the ground, on the driveway. And we all just stood around it and sang her happy birthday. And after 5 minutes, we all got in the car and went home. And it was so terrible and so sad in a way, but in another way, it really made her happy because in her mind, she was just going to spend her 75th birthday totally alone. So for us, the bubble, we have friends that we trust implicitly, that we've sort of grown up in this pandemic together where we're all isolated. Our kids are all isolated. There's like 2 or 3 families that we just feel comfortable sticking together. But then there's the bubble of our extended families. And it's not so much that I worry about what might happen to mine. I worry about my kids bringing something to my mom or to my in-laws. And so we kept apart as long as possible until we started sensing very clearly from all of the grandparents of my kids, that they were becoming depressed. And frankly, it was really obvious. At first, you know, we were all very gung-ho and we would drop off groceries and wave and, you know, we laughed about it. But maybe 6 weeks in, I started to notice, like, my father-in-law especially became more and more withdrawn, like didn't want to spend as much time on the phone, even though we thought, oh, you know, call grandpa, it'll make him feel better. They needed to see us. They needed to be in our sphere. So at that point, we started to organize very safe gatherings where we were always outside. Everybody wore a mask, no hugging. We stayed 6 feet apart. So they got to put eyes on us. They got to be in our circle physically. That physical piece is so Zoom. First of all, number 1, I hate Zoom. Number 2, it's not the same thing when you're talking about grandparents. And that really made a huge difference. So Joan Neely, that's a really long-winded way of saying your bubble isn't just about the people and their behavior. It's about what those people do for your soul. So there are people, well, if I never see them in person again, my soul will be much better off. And those people are not allowed in my bubble. But there are people who I am like, you know, crushed that I haven't seen. And again, it's not, the touch is important, but it's not necessarily about the hugging and the touching. It's about feeling them next to you in physical space and how rewarding that is for the soul. So like Joan, for you, have you seen your son?
For the first time last Saturday since February. Yeah.
Wow.
First time.
Where?
Down in Cape May. He came from Brooklyn.
Brooklyn.
Where he's, to Cape May.
Yeah.
But you know, Christine, we saw them outdoors. We didn't go indoors with them. We didn't stay overnight. We went home. They stayed. And you know, he's doctoring and he's been tested a number of times. He was actually sick for a while. But anyway, yeah, but it was wonderful, just as you've described.
Yeah, I mean,
yeah.
Go ahead.
Caution for us is still important.
Yeah.
And and thank goodness, the depression hasn't entered in. We've filled our lives other ways.
Yeah.
But thank you. That was a beautiful, rounded explanation, and I appreciate it.
Well, good. I'm so glad. And exactly, just you can do it and be safe about it. Go ahead, Lynn. You have a question?
Yeah, I want to ask a question about testing. You know, we had not thought to get tested until we were supposed to drive our nephew to Maine. Maine requires testing. And then we had to scramble to figure out how to get one and how to get one that actually would be meaningful. So, but it raises the other question is, should we be getting tests just for the heck of it?
Yeah, I think the way you asked the question also answered it. And so I believe in medicine, not just in how it relates to COVID. And Joan, I hope you can attest to this. Like, I don't believe in testing for the sake of testing ever. I believe in testing for information that we're going to take action on. So if doing a COVID test means that the result is going to impact what you do, where you go, how you behave, or how you're treated, yes, definitely. If getting tested is just to say, I got tested and I was negative, or I got tested and I am positive, like, that's not how we should approach this testing. And really, again, philosophically in medicine in general, I really believe that, because you always find things you weren't intended to find, first of all. But in a setting where testing is limited and expensive and uncomfortable, like, we really have to be judicious about why we're doing the test. And I can respect the states that won't let you in without a test. I mean, if that's how they're controlling their environment, then yes, you have to do it. But if you're healthy, no symptoms, you don't have a known exposure, I can't see how doing a test benefits you.
But there's this sort of background thing that if more people got tested, we would be doing our patriotic duty or something. You know, in other words, the more tests there are, the better it is. Is that not true?
It depends on the test you're talking about. Like, I definitely believe that every single person who wants to help out should have antibody testing, you know, the blood test to see if you have antibodies, because that doesn't affect your behavior at all, but it gives us a cross section of what we're really dealing with. So in my practice, we've done 3,000 antibody tests, and we've had about 150 positives. So we have like a 2% positive rate or something like that. And that seems to match up with a lot of areas. 2% is not a good number. It's not a number that implies herd immunity by any means. So was that helpful? It just helps us understand that in Chester County, Pennsylvania, where I am, we don't have a lot of immunity. In New York City, where Joan's son is, in Brooklyn, at one point they had like 20% positivity. So from informational purposes, it's very helpful. The PCR test, I think unless you're going to quarantine, stay off of a college campus, you know, if there was a specific treatment you were going to begin, something like that, that all would be a good reason to do the PCR test. But I can't see how, just for information reasons, it's helpful.
Okay, good. Other questions?
Yeah.
I have a question.
Joan, Doris hasn't asked one yet, and then we'll come to Joan, and then Nancy.
Yep.
And then Sheila.
Okay.
I have a question. I have been invited to a small wedding that'll be held outdoors this weekend. Masks will be worn. And I think I'm going to attend, and the conversation earlier this evening was helpful because I really do need to see some other people.
Yeah.
And I don't want to miss this. It's kind of an important event, but the question that I have that I appreciate the chance to maybe get an answer is, should I handle my quarantine life differently? So meaning that after I come home from this event, just to be on the safe side, should I be more isolated in my engagement with others until I pass the 14-day point to see whether I have become ill as a result of going to the event, if that makes sense.
Perfect sense. So may I ask you a couple questions, Doris? First,
Sure.
Where's the wedding?
It's in Oxford, Pennsylvania,
Mm-hmm.
about an hour away.
Mm-hmm. And who's going to be, how many people will be in attendance?
I think it's going to be about 30 people.
Okay. So I think that I would definitely go. It sounds like this event is important to you. It's not in a high risk area. And these are not simple decisions. We have to weigh so many factors. So for me, hearing you speak in just 30 seconds, I gathered from you that this is an event you want to go to. Listen, I have 3 wedding invitations on my desk right now, and I could not be more grateful to this pandemic because I'm like, sorry, can't go. I'm not going to this wedding because there's a pandemic. But for you, it sounds like this is something really important. So that's number 1. Number 2, it's going to be outdoors. And honestly, you would be surprised at how much safety the outdoors provide. So anything outside, even if it's the same number of people, the same people, put it outside, it's going to be safer. People are going to be wearing masks. And you're not going to a dense area. You're not going to Texas, Georgia, or Florida. So for all of those reasons, I would say you should definitely go. Now, in terms of quarantine, it's the other side of that. It's who are you going to be quarantining yourself from? So if you have some friends or relatives that are very high risk, elderly, diabetic, on immunosuppressants like chemotherapy, you might want to isolate from those specific people. But beyond that, I think being very sensible and maintaining your normal social distancing, always wear a mask, don't go into a crowded situation, stay 6 feet apart, I think it would be fine. Now,
Okay.
if you were going to someplace like Florida, Texas, Georgia, I would say, maybe California even, I would say you should do a little stricter quarantine, but because you're not, I think it's fine.
Okay, well, actually, let me just be specific about what's going on. My husband died April 2nd.
I'm sorry.
The information is that he died, his heart failed, and that seems true. He didn't have any COVID symptoms, but I am feeling pretty bad, and the person who's getting married is his oldest grandchild. And one of the reasons I want to go is because, well, now I'm her only grandparent, even though I'm her step-grandparent, but I also want to be sure that I don't lose my connection with that family. And I'm afraid if I don't go, it might be misinterpreted somehow.
Of course.
But the other thing I'm doing is, so in some ways I might also say, I don't think it's a good time for me because my emotions are kind of labile. I'm definitely experiencing some of the depression that comes with grieving, and then the bottomless effect of grieving in in this pandemic situation where things are kind of bottomless, you know?
Yeah.
So a little, and also I don't want to add, I don't want to, if I should get ill for any reason, I would love to see the family get by without anyone else getting ill. You know,
Aw.
like especially since we just lost someone important. So,
Yeah.
but I am just getting started in feeling comfortable and having friends come by to help me with some things around the house and clearing some space and
Mm-hmm.
moving some memories out of the line of sight, some triggers. And I guess that's what I wonder, if I should put that on hold for a couple of weeks, because my friends are of the same age as I am.
Mm-hmm.
And they have their concerns about their extended families. So I guess
Mm-hmm.
that's that, if that helps any, because I am really concerned about potentially finding out that someone else became ill as a result of all this adventure that I'm planning.
Right, right. Yeah, I mean, I think that would be a very simple way to take a little extra precaution, Doris, is just to put pause on some of the things that you're doing around the house. But I think you just elevated the importance of you attending this wedding.
Yeah.
To me, it seems like it shouldn't even be negotiable. It seems like the benefit and the emotional importance of it are huge. And, you know, life is about taking risks. We've never been so calculated about the risks we take. We analyze everything nowadays. And I think it's right. And I'm glad that you're really thinking it through. But, you know, life and death has gone on through this pandemic. And we worry a lot about who's going to get sick and who am I going to make sick. But then what about honoring the people that we lose during this pandemic that didn't die from COVID? You know, like, it's not all COVID all the time. Your husband sounds like a patriarch of this family and someone who should be honored and revered. And your simple presence at this event may do that. And he probably didn't have a funeral that was of any size, right?
I had nothing. I postponed it a year, which may not be a long enough postponement.
Yeah. So this is one thing you can do. And I can't say it enough. I think the benefit to your spirit and your soul sounds like it would be well worth it.
It's so good to hear that. Thank you so much, because I have been overthinking it and analyzing it almost 24 hours a day. So
yeah.
Thank you so much, everyone, for letting me ask that question. And thank you, Christine, for
Of course,
your helpful
anytime,
answers. Thank you.
Sure. Good luck.
Thanks,
Thanks.
Doris, for that. And so Joan, we'll let Joan ask
Well,
a question.
I've
and then
already
Nancy,
had a chance,
and then-
so Sheila wanted to talk. I can wait.
Well, Nancy is next, and then Sheila.
Oh, okay. Go ahead.
Nancy?
No.
Oh, you didn't have a question. Okay,
Yeah,
Sheila,
someone
you're
else had a
on.
question.
Sheila.
There she is.
Yes. I just was reading something today, a long article with sounded a reputable person talking about the things we should and actually don't need to do. I mean, the mask, the distance, the outside. But they were saying the paying so much attention to doorknobs and touching a table and those things. You see, that it's so unlikely, and you know, you don't have to take your shoes and disinfect them when you come home. You don't have to take your clothes off at the door. My son, who lives in a higher risk area, when all through this, they have children. All through this, whenever they go to the supermarket, one goes at a time, and they bring wipes and they wipe down everything they bring home. I'm guessing that's overkill. I'm guessing that's overkill.
It definitely is, now that we understand what we understand. I love that question. It's so important because, you know, for some people, it may seem like we're slacking off. Like in the beginning, we were like taking our shoes off and wiping everything down and doing all these things. And now all of a sudden, we're not even thinking about that. But it's not a reflection of slacking off. It's a reflection of, what do we actually need to do? Where should we be putting our energy? So just as an illustration, when the pandemic first broke out in my practice, like at first it was sort of like business as usual, but we weren't sure what was going to happen. And by the first week of April, I sent everybody home, and it was just me in the office, and I started wearing scrubs. So I haven't worn scrubs in 25 years, since I was a resident at Jefferson, because I think scrubs make you look like you're either a surgeon, which I'm not, so I'm basically faking, trying to be something I'm not, or they make you look like you just rolled out of bed. So scrubs were not my thing, but I started wearing scrubs, and I started stripping them off in the laundry as soon as I walked in the house, and I would put them directly in the washer on the sanitize cycle, which, by the way, takes 2 hours, and did that every night for a month. And I had my clogs, and I would spray them down with Lysol, and I would, like, there'd be days where I forgot to bring my robe down in the morning, so I'd be streaking up the steps in my underwear because I wanted to get up there before anybody saw me. And then, you know, then you start learning like how this virus actually propagates. It's a respiratory virus. It needs saliva to survive. So there's no saliva on our clothing. Saliva comes in our noses and in our mouths, so coughing, sneezing. It does live on surfaces, so if you sneezed on a table, that virus would be there several hours later. But in order for that surface to transmit the virus to somebody else, that person would have to come along to the table that you just sneezed on, exactly, and literally lick it. So nobody's doing that. So, I mean, I think for how terrified we all were and how little information we had, we were all doing everything that we thought we had to do. But this has been an evolving situation. And thank God it has evolved to the point where I can wear normal clothes to the practice again. And my kids don't have to scream at me for running up my steps half naked because I'm like, everything's back to normal. So I think we can really distill it down to like the 5 staples, the pantry staples of this disease: mask wearing, social distancing, hand washing, avoiding crowds, and not going out when you're sick. Those are really the 5 things. Everything else, wiping down your groceries, no. Now, honestly, I will say when we started doing that, you know, like you go to the grocery store and you pick something up, you're like, no, I don't want it, and you put it back. Now, all of a sudden, I'm like, ugh, gross. How many people touch this can of baked beans or whatever? We never used to think about that. So now I'm much more likely to do that and then wash my hands or sanitize after picking up 5 million things. But not so much because I'm worried I'm going to catch COVID from the can of beans, more because it's disgusting to have like these germs, these non-COVID germs pass between hands. So I think, yes, all that stuff is excessive. And I also think people that are really continuing to do these behaviors are doing themselves a disservice, because all that energy, all that time we're spending, every time you wipe a grocery with a Clorox wipe, you're reminding yourself that we're living through a pandemic and life is ridiculous. And how many times can that thought go through your head before it starts to make you feel a little crazy? So, you know, maybe we can limit the perseveration by not wiping down everything that comes in the house. That's just a very simple thing to do.
And I was also thinking of our library. When you return the book, they wait 72 hours before they cart it and put it back on the shelf. And it seems to me, unless you're spitting on the book or something, oh, it's probably okay.
It's probably okay. I know that in our practice, you know, between patients, we sanitize every surface because we just can't take any chances. And I do think even if there's a 0.001% chance somebody's going to pick something up in the office, we've got to be extra cautious. But we just found a disinfectant spray that if you let it sit wet for 1 minute, it kills like 99% of all the COVID viruses that might be on the surface. It just has to sit for 1 minute. And meanwhile, we're, you know, putting books away for 72 hours. It's definitely excessive, but it comes from a good place. It comes from a place where people are trying to do the right thing and just don't have enough information to scale it back. So if I were you and somebody returned a book like Pride and Prejudice and you're dying for that book and it's only been 50 hours, take it. Go for it. It's going to be okay.
Oh.
Do we have any other questions for Dr. Meyer?
Okay. Joe. All right. My son and his family spent a week in the Outer Banks and they shared a house. It was on the beach, but they shared a house with 3 other families. So I told him, when he came back on Sunday, I said, if you don't mind, I said, I want you to know I am going to quarantine. I'm not going to be in contact with you for 14 days, especially given you're traveling and being with the other families.
Mhm.
Is that, was that the right thing to do?
Yeah, I mean, it's certainly not wrong because you have limited information, Joan. In your situation, like, let's compare your situation to Doris's. So your son was in North Carolina, a hotbed of COVID cases.
Right. Right.
Chances are, if they were sharing a house with 3 other families, they were in a house, enclosed space with 3 other families for a prolonged time. So not just for a few hours at a wedding, you know, we're talking a
Right.
week together. So, and I don't think it's wrong. Now, if you had information that it was, let's say it was all of your kids and they had been quarantining together from the beginning and they never left the house in the Outer Banks and they cooked and did everything there, which is, you know, I wouldn't believe them if they told you that's what they did. So is it, would it have been wrong for you to see him? I would have been a little nervous, but I also think the better part of valor is to be cautious when you can. If you're not missing something, you know, if you're not feeling like, oh, I missed his birthday or I missed this huge event, in 14 days, he'll still be here and it's fine.
Yeah. Yeah. Okay. Yeah.
Good. Other questions? Looking at it's we have a few more minutes, but you know, we could probably all use the time to. Some of us, I will be preparing to watch the events tonight on TV. So
Great. Just don't spend the time sanitizing your groceries. As long as you're not doing that, it's good.
So Joan Neely, I would just like to thank Christine. This is why she's been my doctor for these, 25 or more years. Same for Joan Skyvo.
Yep.
She's been wonderful and helpful and practical and the best
If you
doctor.
ever get sick, if you ever get sick, you want Christine taking care of
Oh, thank you guys. So nice. I pray that nobody ever gets sick there. You guys have been lovely. Thank you so much.
Thank you.
Linton, thank you for inviting me. If I can help anytime, let me know.
Yeah, but before anyone signs off, I want to ask this question. We've been recording this. We could make the recording available to other members, but you have asked personal questions. I want to get your permission to either share it or not, and we're perfectly okay not sharing it. So particularly Doris, I want to ask you if it's okay if we share.
Nice.
Okay, I see that.
Yep. Yep.
Okay.
Fine
Okay.
with me.
And
Good.
Sheila.
Yes, where's the hand?
I saw. Yeah. How did you do that?
Yeah.
Under what?
Under.
Under more, like if the top right of
Oh,
your screen, the 3 dots. Yeah.
3 dots.
Either more?
I don't see that.
Oh,
I
yeah.
don't have 3 dots.
Huh.
Oh, I see it.
Huh.
Oh, you got it, Joan.
No,
Yeah.
Oh, all right. Well, we'll be practicing that.
Yeah.
Okay.
All right. Thank you all so much, and thank you, Dr. Meyer, for joining
Of
us.
course.
Perhaps-
You're
I
welcome.
just learned how to do that. I only learned that last week. It's not an old skill.
Well, thank you for teaching us.
All right.
And hopefully, Dr. Meyer, we can have you back sometime.
Definitely.
Some other issue, maybe. Hopefully not one
Definitely.
this all-encompassing, but
Yeah, anytime. I'm absolutely honored. Everybody stay safe and healthy. Doris, good luck at your wedding. I'm going to say a prayer for you. I hope it's everything that you hope it is.
yeah. Thank you, everybody.
All right.
And
Take
Thank
care.
you. Bye.
Bye.
take care.
Bye.
Yeah.